Yes, a very good morning and many thanks for staying with us right here on NTV Uganda. My name is Romeo Bisiko and of course I'm coming to you yet again with another pertinent conversation, largely focusing on the coronavirus pandemic that is still causing a lot of headaches in many other countries except Uganda, because we've been seeing a dwindling number of cases owed to the coronavirus pandemic. I'm talking about some 164,000 plus cases of the COVID-19 disease and around 3,596 deaths being registered right here in Uganda. The good news is that we only have two severely ill patients in two hospitals within the country. That is Mulago National Referral Hospital and also St. Mary's Hospital, Lacho. Only two, and it's because these individuals were not fully vaccinated or even vaccinated at all in that regard. And according to the Health Ministry, they are telling us we've reached a milestone when it comes to the vaccinations within the country. Over 48% of our people in this country have been vaccinated. That is around 10 million of our Ugandans have been fully vaccinated, and around 15 million of our Ugandans have been partially vaccinated. That means they've received at least one single dosage of either vaccines right here within the country. So that is a milestone. What else needs to be done to ensure that vaccinations cover the entire country? We are also getting information from the Health Ministry that outbound travelers who are leaving the country do not need to present a negative PCR test 72 hours before leaving the country. Even those who are coming into Uganda, you do not need a negative PCR test 72 hours before jetting into this country. Even for the 5-year-olds, these requirements are not required within Uganda. But will that actually lead to a sense of complacency among members of the public, whereby people disregard the usage of face masks and so forth, whereby we open our doors for these individuals coming in from hotspot countries where COVID-19 is still pretty much a problem? I'm talking about South Korea. They've been registering over 50,000 cases within 24 hours. Countries like Italy, countries like Japan have also been seeing a record number of coronavirus cases. So if we allow these individuals to come into Uganda minus presenting a negative PCR test of COVID-19, what does that really mean? So I do have Abu Bakr Luada. He is the Muslim district PRO for Luweero district, and he's here with us together with Tadeo Atuhura, the communications and partnership manager at Maldme Uganda, to make sense of the COVID-19 vaccinations within the country and also the role of the leaders, especially the religious leaders. What kind of role can they play to increase the vaccinations within the country so that people do not regress with the COVID-19 disease as it is right now? A very good morning, Tadeo Atuhura and Haji Abu Bakr. Thank you for joining us.
Well, good morning, Romeo.
Indeed. Of course, we did do these conversations or interviews, that is last year, talking about the COVID-19 messages of hope, reminding people why they should actually go and get vaccinated. As it is, we had a target of 22 million people. 15 million people so far are partially vaccinated, while 10 million are fully vaccinated. That is a milestone. But let's remind the public why we are holding such interviews or a series of shows like this one, because this is not the first. Friday we are still here. Next week and the next one we shall be talking about the same. Why COVID-19 messages of hope, Tadeo? Let me start with you.
Thank you so much, Romeo, and great morning to the viewers. First and foremost, would like to congratulate ourselves for having reached that milestone.
Indeed.
And like you realize, the situation that is in the country is not like situations the world over.
Indeed.
There are some countries that are having challenges. And you asked a very pertinent question, why the COVID-19 messages of hope? Now, as an implementing partner, Maldme Uganda, of course, funded by PEPFAR CDC, in partnership with the Minister of Health, we came up with an innovation of engaging the faith leaders to reach out to different people about COVID-19. Now, why was that? Like you've said, we've been discussing this for quite some time. And the bigger part of it was the faith leaders are really reaching out to people on a daily basis. But also the other aspect is that they believed so much. Whatever they say is what we take. Whatever my priest says is what I take. And at the same time, we interact with our faith leaders at different platforms, but also for different reasons. So reaching out really with this message of COVID-19 through the faith leaders was really very instrumental. And I must say, it's these efforts, it's part of these efforts that we've seen this great impact that you can talk about 2 people still in a hospital.
Indeed.
And that also raises the other issue why we're here, is statistics show that, or information that we have, is that even those 2 people are there because they were not vaccinated. So we're looking at vaccination, which you have been resounding, that please, let's go for vaccination. It's one of the ways that you're going to see us have total eradication of all this COVID-19.
Indeed.
Yes, so it's part of how can we contribute towards ensuring that these numbers totally go completely. We no longer want to hear of any cases. Children are going back to school, others have already gone back. But the bigger part is that how many of even the parents have been vaccinated? How many of those children that are supposed to be vaccinated have taken the vaccine? Because it's only that that's going to be able to enable us achieve great milestone as far as COVID-19 is concerned.
And indeed, community leaders have played a huge role today at Uhuru. But why are we banking on the religious leaders this time around to ensure that we spread this message? What role can they play?
Now, the role they can play, again, is mobilization. I appreciate so much the leadership from Luwero for the Muslim community. We've just finished celebrating Eid.
Indeed.
And now the messaging on the Eid day, even across all the mosques, was please kindly be able to follow the SOPs. Yes, we've had some relaxations like you're highlighting, but again, they came with some restrictions as well. 2 meters for you to remove your mask. If you're going to be in a matatu or a taxi, you can't actually observe the 2 meters because it's supposed to be maybe a 14-seater. So it means again you must have your mask on. But at the same time, you must be fully vaccinated. Now, our faith leaders is to be able to have that message to our people and say, look, yes, we've got some relaxation to do, but there is more work. And like I said, their message is very powerful. And I know with Sheikh here, it's also to demystify the other things that have always been talked about.
Indeed.
And somebody was saying, no, actually, this is, it's not even accepted religiously. You can't be able to do this and that kind of thing. We all know that COVID-19 is a disease. And the only way to fight the disease is to observe the SOPs and follow the guidelines as far as the scientists have been able to tell us. So by articulating that message through the faith leaders, it's going to create a long-lasting impact to our people. Remember, Romeo, we are talking about change of attitudes. We're talking about change of behavior.
Indeed.
And that happens really consistently over a long period of time. But it's also about who talks to you about it. If your faith leader is talking to you about it, chances are that you're likely going to listen, because the belief is that that is God talking to you. And
indeed, the good thing you spoke about change of behavior. Some of us, even after the economy was reopened, bars were open, other, recreational facilities were also open. We haven't set foot there. We are still back in that mode of, a lockdown. You go to work and then you go back home. You ensure social distancing along the way, wearing of the face mask. To me, it's like the lockdown is still here. But for so many people, it's like the coronavirus pandemic is long gone. The wearing of face masks has long been forgotten simply because the Minister of Health came out and said you do not need a face mask. But what they forgot is that when you are in closed spaces like transport services, the taxi, there's no way you're going to social distance, those 2 meters. So you need to be wearing a face mask. All they said was if you are outside, then you do not have to put on a face mask so long as there are no people around you. So let's talk about the role of the faith leaders themselves who have been engaged fully in the dissemination of these messages of hope as far as COVID-19 is concerned. Haji Abubakar is here with us. We're going to break down some of the roles they've been playing to ensure that we reach this milestone of over 15 million being partially vaccinated and over 10 million being fully vaccinated. Haji Abubakar, entice us with those details.
Thank you, Romy. First of all, let me thank the management of NTV for this very huge effort.
Our pleasure.
In combating the issue of coronavirus. As you said, over 6 million Ugandans.
All over the world.
All over 6 million in the whole world. Come here in Uganda. Leave alone those who are not known. Very many prominent people have gone. And here in Luwero district, where I work as a PLO, I want to first of all appreciate the leadership of Luwero district, Sheikh Ramadan Mulindwa. When it started, worked with Maidme Uganda, a lot has been achieved. We started at the district level here what happened was that all of us at the leadership of the district were called, briefed, and we started. The moment the district has put his hand up and he was vaccinated, that was an order for everybody. And indeed, it is true, it moved down to the county sheikhs. The county sheikhs did the same. Later on, it moved to the imam and almost every mosque. Now,
exemplary leadership.
the exemplary. And indeed, it is true, started from Uganda Muslim Supreme Council. Sheikh Ramadan Mubajje has been at forefront. And definitely, the Muslims were waiting to see what are the leaders say. Has put it clear. For us, the moment we meet people 5 times a day. We have Fajr prayer, we have Dhuhri, we have Asri, we have Maghrib, and we have Isha.
Indeed.
Every other time, wherever, after meeting, you say Salaam alaikum wa rahmatullah. Before you say anything, you remind people. Because as they are entering, of course, there are SOPs. Definitely. You remember, Muslims community were hit badly. Because for us, we congregate 5 times. And it's a time when it came to that no congregation prayers. So we are waiting. And there is a lot of reward when we meet together. A lot of rewards. Actually, it is times 100. When you pray alone, you don't get the same rewards compared to praying with others. Now, when it came to, okay, fine, we can come to the mosque, but social distance. That was the first time, you can imagine. For us, we have been, according to a hadith of Muhammad sallallahu alaihi wasallam, it is supposed to be hand on hand and foot on foot. Now, this time around, we say this. So, going back to where Shey with the team moved to almost all sub-counties of Rural District. And definitely, we have almost a very big area. But it was not only that. They moved on local radios. We have some local radios around. The radio Nakaseke, the radio what, and using. And then too, we still thank his department. They did a good, exactly. They did a good job by giving us messages, printed messages, which were moved to all sub-counties of Kamira, Chichusa, Zirowe, Kalagala, Bombo, Rueru sub-county, and Nakaseke. Are you getting? This helped us. And actually, if you looked at the data, you find that the Muslims in Rural District have done a great job when it comes to immunization. And I want to assure you that the other day we celebrated Eid. I was the guest in Kalagala sub-county, where all mosques we gathered. And I want to, as much as the call is there that remove the mask, but people continue to put masks. First of all, coronavirus brought this one, it's hygiene. Sometimes you need it. Let me give an example. I am a director of Abusha schools in Bombo. I pray with children. And I cannot remove the mask. Because naturally these children have flu, what.
Indeed.
Exactly in the morning and whatever. You have to go and pray. So it is compulsory that you have to put on what? Mask. I thank whoever brought the idea of the mask, because we didn't know it before coronavirus.
Indeed.
I get it. And I also want to thank the leadership of this country. Let us agree. The president is exemplary.
Indeed.
Up to today, he is a person who is not going to meet you. You never see him nearby people, naturally. Are you getting it? And he's trying to show signal to other people that, please, things are not good. So, we've tried, and the numbers are low. The only challenge is the news which are coming up from China, Korea, as you put it.
Indeed.
Vis-a-vis the policy now, the announcement by the Ministry of Health, when you said that these people can enter freely, members, we are forgetting. We learned nothing and we forgot nothing. Because, first of all, these are not our neighbors. As much as we know that Uganda is a landlocked country, These are not our neighbors of Kenya, Tanzania, Rwanda, Burundi, Zaire. No.
Let me get this straight.
People coming from out.
You feel like the new requirement by the health ministry to have these people not present a negative PCR test 72 hours before coming to Uganda is a big mistake?
A very big one. Romy, please, you imagine what's going to happen.
Indeed.
Because these people are coming here. And we are going to here now, we have started going back. Members, we tested, first of all, if it is to lose this of people, we have lost. If it comes of the business of locking down 2 years, me, I'm an educationist.
Indeed.
Are you getting? 2 years, the business and whatever. So we must do whatever it takes to see that we protect the Ugandans. And we will thank the government over that. I'm requesting kindly that minister should sit back and say, please, no. When it comes to, actually, we can even zone these countries which we know, that please let us first ensure that this is not going to happen. As we have played our role, they were requested as religious leaders. We've done whatever is supposed to be. Now, what about now? Are you waiting again to bring, you know, the Baganda say, what are you doing? You know that this is going to kill your husband, and then after the death, now you are telling us, please. I was aware of what was going to kill the husband. Definitely, we know that coronavirus is still at large. In other countries, they are going for lockdown. They are reporting 50,000. What? No. Why don't we block? Because we know it's not in Kenya. It's not from the neighborhood, but the only road is Entebbe Airport. Are you getting?
Indeed.
Let us make sure that we close so that you don't bring. I am very happy about the issue of the continuity. And to be even now, definitely we are very close. Even when you are entering here, you are observing SOPs and everything. Can we continue? But we prevent. Prevention is better than cure. Quran is very clear about that.
So you're saying even though we are registering fewer cases, people need not grow complacent. They need to continue adapting to the COVID-19 SOP.
If you are in a bus going to Arua, going to Chisolo, what's the problem with putting on your mask?
Indeed.
You are not sure of the person you are going. If you are talking about 2, even if it's 2%,
even though you're fully vaccinated.
Even if. By the way, you feel very comfortable in such a bus. Are you getting it? But when you are putting on your mask, what's the problem is that? 2, what's the problem is going with your sanitizer? The other day we had the Juma prayer at the old Kampala. You know, we are renovating the mosque.
Indeed.
Are you getting at the old Kampala? And of course, there were very many people. But you do see over 30% are putting on their what? Those not compulsory. Those not compulsory. So what's the problem? 2, the issue of sanitizer. It's part of us. Like in Islam, you are aware that wherever you go to a toilet, you must have water under all circumstances. Are you getting? You must wash using water. I mean, using soap. Islam Nazifa. Are you getting? Islam teaches about cleanness. What about the problem with sanitization? Why don't you sanitize all the time?
Yes, Haj Kalome.
So, what I'm trying to say, we in the Muslim community, we want to appreciate the leadership of Luwero, the leadership of Uganda. I am aware, this early morning, just as I was coming here, I met around 5 this week others. This early morning. That one of Bududa, that one of Slonko, that one of Toro Ajasante, and that one of Bukedea. They were going to meet. I was telling them that I'm going to talk about COVID. Say, true, talk about it. Our people are starting relaxing. I get it. I was telling them, please, I'm going to the interview right now. We have a show. They say, please, we can now, you can talk. So, people, these are leaders of the whole region. Right now, they are just going to the parliament. So they were telling me that, please, it's very important we continue. So when you say you are going to have it even on Friday and whatever, please let us continue. And finally, on the same, urging Muslim leaders, religious leaders, not only Muslim, even the church.
Yes.
Are you getting it? The church also have big gatherings. Are you getting it? Can we continue reminding ourselves about this enemy? And we tell people that, please, the enemy is not yet over. When I was entering here, Please, I was very happy.
Indeed.
I was telling the gentleman that, please, you need me to put on a mask? Say, hey, you man, you're getting man, please, should be rewarded. I'm telling you. Told me, you don't know what is happening in China?
Indeed.
You don't know what, oh, it is terrible. We rather be strict. And this was the gate man. If the gate man is aware of that,
Indeed.
let all our religious leaders go back to church, mosque, and everywhere, and we do it again.
Indeed.
Because the man is coming, the rebel is coming. This time around, he's coming from the known place. You know, I'm a retired
China.
major in UPDF for
Indeed.
information.
Indeed.
I retired. So when it comes to being strict, when it comes to the enemy,
Especially the invisible one.
the invisible one, that one is so dangerous. We should revisit the decision of the 72 hours.
That is Haji Kalume Abubakar, is the that is the PRO for the Uganda Muslim Supreme Council in Luwero district. He's not alone in studio. We also do have Tadeo Aduhura, the communications and partnership manager at Mount May, Uganda. Well, even if you're fully vaccinated and you've received your booster dosage of any COVID-19 vaccine, you can still get the Omicron disease of COVID-19, the Omicron variant of the COVID-19 disease. Why? Kamala Harris, the Vice President of the United States, recently she got COVID-19. She's been fully vaccinated and she's also been double jabbed. I'm talking about a booster dose. She's already received it, but she got COVID-19. So we need not, you know, drop the ball on this one. Continue wearing your face masks and so forth, even though you are fully vaccinated. Let's continue, you know, showing people why they should continue wearing these face masks, even though they are fully vaccinated. It's important.
Yeah, and thank you so much, Romeo. Just what Haj has
and you can also
out.
share on the latest directive from the Health Ministry.
Yes,
whether it's right or not.
you know, I think one of the things that we appreciate so much the Ministry of Health is they've been able to lead us so well.
Indeed.
And we were able to reach up to where we are. And by the time we have these directives, they're based on to analysis to see how we can be able, of course, as a country, I must say we're living with COVID-19, as well as living means you're having other things going on, the economy is moving and all that. We know that we have got people who must visit our country, and we know that there are people moving from our country to the other countries as well. So for purposes of making sure that our economy is actually moving on very well. And one of the things that I want to point out very clearly is that the fight against COVID-19 is really about me, is about you, Romeo. It's about the Haji to take the personal responsibility and initiative. Why? Because we've had all this other support. The information has been delivered to us. The vaccines are available. And I'm so excited that even people are coming to take up the vaccines. Where we are vaccinating at Maldme Uganda Hospital through the support of Wakiso district. We appreciate so much the district. And the people who are coming for the vaccination. We are doing testing for COVID-19. And this testing is an initiative from an individual to say, let me go and take a test and find out whether I have COVID-19. And the wearing of the masks is going to be a personal responsibility, because I'll tell you, it's you who judges. As we talk now, Romeo, there are some institutions that really have maintained a virtual connection throughout, even if there's been opening up of the economy. I'm so proud that the partnership that we have with the faith leaders, they're continuously having this message down to the grassroots, that can we be able to wear your mask? Can you be able to ensure that you're sanitizing? I was so keen to all the coverages that you are doing during the ED celebrations,
Indeed.
The prayers, and the reporters on site kept on saying, yes, we are here in Chibuli, we are here in Old Kampala, and people are really wearing their masks. That is very important. Now, the other aspect is to emphasize to our people about vaccination. Romeo, I think since the inception of these discussions, we kept on saying, yes, we can do all the SOPs, we can do all the washing of hands, we can do all the masks, but the bottom line, can we get vaccinated? And at that time, there was this thought that, no, I think vaccines have issues and that kind of thing. But guided by the ministry, it was very clear that the vaccines are the only way of how we are going to fight this monster called COVID-19. And then we can be able to enjoy our normal lives. One of the things that I want to emphasize is that it is possible. If we all get vaccinated, Romeo, it is possible that we can have really COVID-19 put at bay. Now, listening to the messages from our faith leaders, which is very crucial, is that they help us to understand these as far as changing our attitudes are concerned. Because there are all these mysterious misconceptions around the vaccine. You know, we had situations whereby somebody was saying, no, when I get vaccinated, I want to give birth to children. When you get the vaccine, it's a chip inserted in you. They want to track you. When you get vaccinated, you're not going to live even for a year. I've been fully vaccinated and I'm here.
Indeed.
You see?
Very healthy.
So he's very happy and very strong. I believe that also Haji was vaccinated.
Yes.
I was around when they were vaccinating the district card for Luero. And he's still strong. So those kinds of misconceptions can only be managed at a point where information is consistent, constant, and to the right audience.
With conversations like this one.
Yes.
Go ahead.
Conversations like these ones. But also we have those conversations that take place in the spiritual realm. If you go to church and the priest, the reverend, is talking about putting on a mask, trust me, they will go much more than if another person was talking about it. When you go to the mosque, what Haji was pointing out, like it was an order. And indeed, I saw it myself. Once the district other was vaccinated, everyone came up to get vaccinated.
And they followed suit.
Yes, because we believe that the leaders, the faith leaders, are able to take the message down up to the grassroots level. Remember, Romeo, the faith leaders interface with us at all times.
Indeed.
When I'm celebrating something, I need to call my priest. When I am in agony, I need to call my priest. When I'm sick, I need to call my priest. You know, when to be prayed for.
In all spheres of your life.
Exactly. So at the center point is this faith leader. And what our initiative has been able to do, can we be able to give them the information? Can we equip them with the right information? Can we be able to give them the materials for reference? Can we bring this service closer? Can the district people be able to bring the vaccine closer? And I appreciate our partnership districts where we work, Luero, Nakaseke, Mubende, Mitiana, Kasanda, where really in partnership with the Ministry of Health, whenever there are these outreaches, the vaccines are made available for the people to be able to take the vaccines. One of the things that we would like to emphasize really is that this can go on and on because it has a sustainability mechanism. Because every day, like Haji said, he was a chief guest at the function where there were so many other Muslims.
Indeed.
I want to say so many people available. But he took the initiative to continue telling people about COVID-19. And that's what we are looking at. The initiatives that we're having, it's not about having funds that please I need a car to move from this place to another. I'm very sure that Haji moved to that place, met people, and talked to them. It's our responsibility. If you're going to board a taxi, to know I need to have my mask. If I am going for this meeting, and I think that there is a crowd, can I wear my mask? Can I sanitize? I was very keen when I was walking to NTV this morning, and I was so keen on the door. The practice has been since COVID-19 broke out. Is to have it open. You just come and enter.
Yes.
Now I was keen and said, now that the relaxation is on, what do I see? The same door is still open. The sanitizing is still going on. It means that we must keep this practice on.
And it also means that we learn too much.
Exactly, yes. Because if we relax, then we're going to have an issue of again seeing these cases.
That's what happened to the United Kingdom.
Exactly.
When they fully reopened and said, okay, if people are fully vaccinated, please come out and go to the bars and do whatever you want.
Yes.
People came out minus the face masks, thinking the vaccinations are going to save them. And guess what? That led to the Omicron variant of the COVID-19 disease being birthed and so forth, cases going up in the United Kingdom, 50,000 to 100,000 cases. I was like, what is going on? They had to call them back into a lockdown. So even here in Uganda, we feel like a according to the investigations we've been doing as NTV Uganda, our people are forgetting about this heinous disease, COVID-19. And they might also forget how it affects their bodies or how it infects them. So right here on this show, I'd like you to remind our people the first symptoms that you could look at and be like, okay, I have COVID-19, I need to seek specialized healthcare.
And just as we come to that, Romeo, is that somebody was telling me in part of the field activities that we are moving in and said, now we are used to COVID-19.
That's too bad.
We are used to COVID-19. And then they said, okay, you used COVID-19, but what are you doing to make sure that you're used? Because it can be that you're living with the COVID-19 and you know how to keep your space. But there are clear things that the Ministry of Health has guided us in terms of headache, in terms of the sneezing, in terms of body weaknesses, and you're able to say, okay, maybe I'm most likely, I'm exposed. But also you can be able to know if you've been with maybe the person who has had tested positive and has COVID-19, for you to be able to say, I think chances that I'm exposed. Now, the challenge that we have is that, you know, with separating the cough, the flu that we have normally had.
Yes, yes.
Haji was talking about.
So people are confused, you know, when it comes to verifying
and
those.
Somebody says that
is it cough? Is it COVID?
Yes, but I think from the science that we have been told that even when you see those coming in and they are really taking quite a number of time, and you're getting some kind of temperature, you know, there are those that are associated to your body pains. They are associated to, no, this is not just like the normal cough. I don't want to say that it's normal cough.
Actually, it's not normal cough.
It's normal cough, yes.
You might not even cough at all, but have those, you know, sneezing all the time. You have those runnings,
yes,
but you're not coughing at all, and you're spreading.
Kindly test. And we've been guided through, even when you test and you are positive, what do you do in terms of isolation? And that's what they call now living with the COVID-19.
Let's talk about self-medication.
It comes, of course, that's one of the things that the experts were advising us against.
Could it be that we are only looking at 2 seriously ill people in St. Mary's Hospital, Lacho, and Mulago National Referral Hospital? Could it be that there are more people out there who are falling sick owing to the COVID-19 disease and are not seeking health care, and they are instead self-medicating? Could that be the case? It's not only 2 cases, but people suffering within their houses.
And that could be true. Because one of the things that when you see that severity at the hospital level, it means that there's been a process, either delay that has led to that the people feel that now we can go to the hospital. And one of the things that we encourage is that please, even for any other, even if it is malaria, please, self-medication is not the way to go. Go and see a physician. Go to the hospital. The government has given us these opportunities. In the hospital, in the facility, even if you go to where at the lowest health facility, there are people there who are going to attend to you. Beyond just COVID-19, when you feel sick, one of the things that we have with healthcare is that if you delay to seek healthcare support, to go to the hospital and see a doctor, you are actually increasing the severity rate of what may be affecting you. Sometimes, Romeo, we think that I have, I'm feeling fatigue, I'm feeling, I think there's some fever, therefore I have malaria. Then I want to rush and buy some anti-malarials and take.
But it's something else.
And sometimes it's not about, really about malaria.
Leading to drug resistance.
Yes. So by the time you reach the hospital and somebody is telling you, no, actually this is not malaria, that like you thought, it's something else. It is actually at another level.
Find out what you treat.
Yes, so even in this case, when you see these symptoms quickly, go to the health facility. The health workers all over the country, with the support of the Ministry of Health, have really been sensitized about how to manage COVID-19 patients. And they will say, okay, can we isolate? Can you be able to do this? Now, the other thing that is there is the home care support, where the facilities can actually be able to go and support. We're doing it at Malma Uganda Hospital, where we're able to support patients in their homes, which is at their comfort, but they're able to get actually supported. But there is this issue of saying, no, for me, I will be at home, I'll get my jinga, I'll get my my passion fruits, I'll get this, I will steam,
aloe vera,
you know, and then I will remain there. We have been advised that please, the steaming sometimes is not about helping you. it's actually worsening. We have seen some cases whereby people have said, I've been steaming for all this long time, but I'm not improving. By the time they have presented themselves to the hospital,
it's worse.
They're actually in a dire condition. So the only way, our friends, our people out there, if you see these symptoms, please kindly go to the health facility for care. And then for the other part is that take the vaccine. Have you been vaccinated? Those are the fundamental questions. And when you have you're interfacing with your religious leader, check. Have they been vaccinated? The other day we were saying that you need to walk the talk. That when you're talking about something, you need to have actually done it and say, I've been vaccinated, I am okay. The other
Actually, now you don't need to tell me to sit on a border while wearing a face mask, because I've learned something. This Omicron variant is actually behaving in a very funny way. You could have cough for over 4 months, over even 3, and you're surviving with it. You're sneezing 1 week, 2 weeks, 3 months, you are there and you are suffering, and you're not actually getting so ill, but you're passing on this disease to other people. And some people think it's normal flu, but actually it is the Omicron variant of the COVID-19 disease. So please seek specialized medical health care in that regard. We do have, that is Haji Abubakar. He is the PRO for the Uganda Muslim Supreme Council for Luwero, and he's going to tell us some of the challenges the religious leaders have encountered, especially the Muslims, when it comes to enforcing these SOPs and also disseminating the messages of hope as far as COVID-19 is concerned. Haji Abubakar, challenges.
Thank you very much. Yes, a number of challenges have been encountered when we are trying to pass this. Number one, let us go to the putting up these facilities. Fridays, we are going for the mosque. And you want to see, most in the rural, Luwero. You know, for you are here, you don't know deep Luwero. That is Chichusa sub-county. You go down, you have around 70 people are going to go the mosque, and then you tell them, please, you must ensure that you first wash
your hands.
I get it. Your hands, sanitize. And sometimes this person is not going to be able. Even when you talk about sanitization, what do you try to mean at that level? Though you would like to do it, and we do.
So the language we use, you think, also
it's
has
not a language.
Yes.
But even how you are going to implement it. Let me give an example. There are very many organizations which came up and supported rural schools when it comes to the issue of sanitization. Put up a system, and the child will just come and push, and then sanitize and then continue.
Yes.
So if we would also have the same, maybe like my colleague who is here in that organization, if can think that every mosque can also have that facility, that would solve that challenge. That's number one.
I'll call out the health ministry to do that.
And, no,
Where is that COVID-19 money? With that COVID-19 money, we can
so
do all
close,
this.
Definitely. He's so close to ministry than me. That's
Go
number
ahead.
one.
Yes.
Then number two challenge is that the language, English, as a media of communication, down in Bamnanika sub-county, we have a parish where even if you wanted what, you must either speak Ateso, I get it. You never Bamnanika here, I get it. You must either try to speak their language, sort of that way they are not going to get what you are saying. So sometimes these people do package their messages in English, and they believe that everybody is going to. Whereas we want an Ateso, you know, this time around Uganda is full of people have moved.
Different tribes.
You don't think of having Luwero that's Luwero is only for Baganda, for whatever. But we need this message to go into all types of language, so that people can understand and read. That's another challenge.
And that's where the religious leaders come through.
Definitely.
To reach out to these people at the grassroots.
Definitely. Then the other issue is facilitation. We see billions and billions of money. The Ministry through the Ministry of Education, or through the Ministry of Health.
Yeah.
And you see that the share is not even given 20,000 to put in a border to go and pass this information to Channa Mukaka zero we wakatai. I get it.
Indeed.
If this check can be facilitated, you get this information very fast. Sometimes it's also very, COVID also caused a very big problem of poverty. And sometimes you find somebody who is willing, but how to reach there?
And the bar of soap also that would have helped us in this fight is also way up there.
Definitely. And that's why we see the organization comes at the district, and the district performs very well, but reaching down there is still also a challenge. Then another also challenge is that some leaders who have not embraced the message, they whisper into people, I mean, I will not go. I cannot do that. That one causes also a very big what?
Challenge.
There are some people who have not been convinced, and they are influential. He may not be a religious leader, I get it. But in a society, we need to reach everywhere. Let me give an example. As we had a gathering, and this is a gentleman who is very respectable in an area, and everybody would go there, would know. Later on, we realized that for him was telling people, me, I cannot go vaccinate. I get it.
Spreading the misinformation.
Definitely. By the time we realized that one, we had even to organize the county sheikh that, please, county sheikh, you have to go and visit this gentleman so that you don't disorganize the whole thing. So those people are still there. Definitely don't forget about the rural setup with its challenges. As you want to go and test, somebody cough has been cough, but the issue of poverty levels also is a problem. Then the hospital, the way he's talking as if everything is okay. I know. There are some health centers where getting support is not there, mostly in our setting. Are you getting? Let me give an example. Last night I was at Nyibas hospital. I was grateful that the doctor was still even working at that time. Are you getting? But you go to another health center, are you getting? There is nobody. And testing, when you mobilize and people come here, they test. There is a lot of relaxation when you go. I don't want to mention, but me, I can mention. I can give around 5 or 7 whatever examples where people have gone and say, I get it. You go somewhere what else? That one is there more so in the rural, in our rural setting. Of course, we have a sub-county called Makulubita. It's a big one with very many parishes, and the parish is almost a sub-county itself. And now you are telling somebody to move and is going to use 20,000 to get the facility. So we need to enforce this, that somebody can easily go and test, because testing, the whole identification of the disease starts with testing.
Indeed.
And people are willing to test. But now, where are you going to test from is another what?
Indeed.
Another problem. One told me, in another one who is working, telling, for us we don't have that fridge which is going to keep it. So are you getting? But I was saying that no, this is a health center 3. If you cannot have it, are you getting? What about who is going to have it? Are you getting? So if you can put
our last hope.
If exactly, these days we have a village, we call it them VHTs.
Village health teams, yes.
And these people are known per village. With all this funding from the Ministry of Health, if we can again retrain these people and equip them, for them they can even go door to door, because we live with them. They can also help. Otherwise, that challenge of moving up and down is a very big problem. Then right now, we have a problem with the messages coming from Ministry of Health, the headquarters. To me, they are not positive. To me. When you are telling people relax, people will put their legs up. I get it. There is a way you should package this message.
Indeed.
But not by telling people that everything is now okay. I am telling you. This is, you get somebody, but you mean you don't even tune on radio? Minister, I saw Minister saying, it's clear that everybody is okay. You can do whatever you want. You put it here clearly. that you say, as long as you're vaccinated, that's number one. Two, as long as you can keep social. For them, that message does not go to my chichusa. I come from
hear one thing that works for them.
the Nyimbwa.
No more face masks.
I get it. For them, they quote only that one of removing the what?
The mask.
The mask. So we should see a way of packaging this message that please, we are not okay. Things are not okay. More so with this rebel now coming, the silent one, as Romy put it clearly, the silent one, as the rebel is what? Is coming.
Very
So
invisible.
these are challenges. I'm requesting that we continue helping us, the religious leaders, by facilitating, are you getting, to we should need also to have also the information. This is the right time if you want to prevent. Conduct a workshop for imams this time around. Are you getting? Don't wait that it has entered Uganda. Imams, where are you?
And it's too much.
Prevention is better than cure. It is right now. Minister of Health that get that budget and go to the imams, go to the reverends, go to put them together in the hall. Tell them, please, this must be done as a way of preventing. The only problem, our community is good when it comes to doing things as if you are stopping fire. Are you getting? Let us not stop.
Reactionary.
Reaction. Let us go
Not
also.
proactive.
We have also problems with schools. Definitely, schools open. Remember, we got influenza and everybody started panicking.
Indeed.
Ministry came up and said, please relax. That is not coronavirus. We have tested and tested and tested and confirmed. But these are people who are in big number. But they are telling schools, but we have not seen Ministry of Health coming in strictly on the issue, business of schools, because schools have big numbers. What plans do Ministry of Health have down there to come at every school? These schools are known. They, to come at every school, one, to sensitize, are you getting, the whole school community, are you getting, and even put up.
I was reading a communique, and I think they're going to start on Monday. That is the 9th of May.
Oh, yeah.
The Health Ministry, the vaccination exercise is kicking off on Monday next week.
Monday.
Yes.
All right. But before that, I am happy about that.
Indeed.
And indeed, I saw it. The Parliament was like, please don't do it. What? Which was bad.
Indeed.
For us, we are willing. I'm a director of schools.
Yes.
And we welcome that idea. But Ministry of Education, Ministry of Health is invisible at the school level. It is invisible. Don't tell schools do this. What about why is it very difficult for you, Ministry of Health, to put up when you tell people go and buy the thermometers, you go and buy the how do you call it?
The temperature gun.
Temperature gun. And the fake one is on market. And you have not even bothered. By the way,
Meaning it's the Health Ministry to avail this equipment.
what's the problem with you availing? Schools are not many.
Well, thank
even
you
if you are
so
giving
much,
two, are you getting?
Indeed.
Two. There are schools which are needed.
To avoid counterfeits.
I'm
That is
telling
Haji Kalume Abubakar.
Yes.
He is the PRO for the Uganda Muslim Supreme Council in the Wero District. We also do have Tadeo Atuhura, the Communications and Partnership Manager at MARDME Uganda. Would like to talk about the challenges that they've encountered as MARDME and what recommendations we could go away with so that we clamp down on this problem of vaccine skeptics. Go ahead, Atuhura.
Thank you, Romeo. Yes, as we go to those challenges, I think we must say that there's a lot of strides that has been made in terms of making sure that the COVID-19 pandemic is dealt with. And of course, there's so many other things that come, but you can also look at the different efforts that have been really made. I think that's why we are up to this point.
Indeed.
So, but like I think there's a point where we discussed and said also COVID-19 enabled us to learn quite a number of things. And if I was to give an award, I would really give an award to the Minister of Health. They've really been able to do quite a number of things to ensure that we have this COVID-19.
Plus the media professionals, they've done an outstanding job disseminating the information.
Yes, it is a journey. Malme, and I know if we're not complacent, we can be able to do and achieve much more. And you just ask about the challenges. I think it's more of the misconceptions around the, you know, this is normal flu. This is flu, we have been with it. The cough, we have been with it. So
you spoke about facilitation not being enough. Is it a problem too for Malme?
The facilitation, because like, you know, for the faith leaders that we're working with, first and foremost, they are always with the people. Like when you look at the county sheikhs, you have the up to the imams, up the lowest level. So when you look at maybe movement, because they are always within their communities. So I think it's not been much of our challenge. Because we know the people that we're working with are actually with the people themselves. Just like I said, while we are not, they're actually there. But I think what we need now to emphasize is the issue of mobilizing more of our people to go and ensure that they take on the vaccines wherever they are in the different facilities. Please go and take on the vaccine. So, and also as we come, I think, to the conclusion, is that we would like to appreciate really the faith leaders for making sure that they have been able to go and talk about the COVID-19, how to prevent, encourage their people to take up the vaccine. And this is something that would like to appreciate across the spectrum beyond just the Muslim community, the Anglican, the Protestants, we have the Catholics, the Seventh-day Adventists, the Pentecostals. That has been really tremendous work. But also we appreciate the DHOs who have been able to support this cause amidst all the challenges that they have. They have really been able to do a tremendous job to have this pandemic dealt with.
Highlight the role of the media in just a few seconds. What have we done for you and the religious leaders?
The media, it's been amazing. Always having this messaging. Always, even when it's about news, it's about coverage, there's always a message that is talked about.
We've been abused and heckled for talking about COVID-19. People are like, okay, you want the lockdown to come back, but all we wanted to just tell them what is happening all over the world so that they can safeguard themselves.
Exactly.
Of course, it's been a journey.
Exactly. It's a journey. It's a challenge across. So the media, you've done a great job to be able to talk about this. And by the way, coming together to talk about this is really very, very crucial. We invite people to come to Malme Uganda Hospital, test for COVID-19, but also for the other general treatment, and as well as making sure that we continue to create this awareness.
And indeed, yesterday I was at Mengo Hospital. I didn't get a satisfactory, job done, but I'll come to Malme and continue with those tests.
You're most welcome.
Thank you so much.